There, come on in. It's good to see you. I am Jen. I'm an actual physician, as you know, and we're gonna get started chatting about, apparently you wanted kind of an herbal medicine consultation? Yeah, that's not a problem. So I went to a allopathic medical school. That is a modern medical school. As opposed to like alternative medicine or as opposed to like osteopathic medicine. Not that those can't be modern as well, but what you think of when you traditionally think of an MD, that's me. That's the kind of medical school I went to. However, evidence-based medicine has always been really important to me, and I took extra classes on integrative medicine, and then I began to really deepen my practice to kind of look into what kind of foods and things that we put into our body can really help improve our health. So I will be glad to help you as much as I can, and we'll go over what herbal kind of concentration would probably be the best for you. Well, as always, we're meeting kind of in this secret place, right? Just because of how, special your job is. So nothing that I say here is official medical advice to diagnose or treat any kind of illness out there in meat space. Because we can meet here, we can do some real medical education and self-care. Yeah, so that's where my degree comes in handy. So let's get started. I will ask you some questions, do kind of a generalized exam, and then we're gonna kind of figure out kind of what teas and what kind of herbs probably are the best for you. Just things that you can start adding into your diet. So I'm just gonna go ahead and write down some kind of your answers here, and then of course I have my computer here, which I will be using to check you in. Right. We operate pretty low budget here. Alright, so my first question is going to be, what are you most concerned about? Okay. Absolutely, yeah, that makes a lot of sense. Okay, what about your past medical history? Okay. I see. And then any family history of significant illness? Okay. I see. Okay. And then kind of going from top to bottom, have you been having any headaches, eye pain, ear pain, runny nose, stuffy face, sore throat? Okay. Blurred vision, spots in your vision, seeing like tunnel vision or like big white starbursts. Okay. Do you have frequent allergies, frequent sneezing, anything like that? Okay. Alright, and then how about neck pain? Like when you move your neck around? Can you tell me a little bit more about those headaches? Okay. And then kind of moving down a little bit, any chest pain, difficulty breathing, especially when you're lying down, painful breathing when you are exercising. And I don't mean like everyone's breathing rate increases during exercise, right? Everyone, especially if you haven't been exercising for a while, finds it a little difficult. But I mean that like when you start exercising, it feels like things are closing up and you're being choked. Okay. And then any palpitations? Have you ever passed out for no reason? Or like passed out during exercise? And by no reason, I mean, suddenly, you weren't dehydrated, you weren't, low blood sugar, you just randomly passed out. Okay. Alright. How about, any belly aches, belly pain? And then any nausea, vomiting, diarrhea? Black stool, white stool, bloody stool, greasy stool that like floats to the top of the toilet? Yes, stool is important. And then any, yeah, exactly. Any pelvic pain? Any problems where you're urinating too much, too little, getting up too frequently at night to urinate? And then sexual health. Any discharge? And how many partners in the last year? And then, any musculoskeletal pain? So when we're talking about that, I mean leg pain, back pain, arm pain. Any numbness or tingling? Any difficulty moving, like where your limbs drop out from under you? Okay. Any pain that's like shooting? Or feels like ants crawling on your skin? And then emotionally, have you felt in the last 2 weeks down or hopeless more than half of the time? Okay. And have you lost interest in the past 2 weeks? Well, this would be over a longer period of time, but thinking about the past 2 weeks as a sample, have you found that you've been not interested in activities that you normally liked more than half the time? Like you just didn't care. Like say you normally like to sew, normally it makes you really excited, but you can't think of more than a couple times in the past 2 weeks you've even felt like doing it. Yeah. Okay. Nightmares, difficulty sleeping. Okay. And getting along well with work and family. Okay, that's a good kind of general review of systems. Let's go ahead and do a quick exam, then I have a couple more specific questions that I'm going to ask you. Alright, so let's get our hands washed first. Alright, perfect. And I'm just going to press on your scalp gently, okay? Just gently. And here. Okay, follow my fingers. Perfect. And just real quick. Just real quick here. Just gonna look in this ear real quick. side here. Just quickly, I'm gonna kind of look in your ear, right over here. Okay. And then can you lift your nose up like this for me? Okay, perfect. And then open your mouth and say ah. And then just stare straight at my shoulder. Okay, and again. Perfect. I'm just gonna look in your eye real quick. Just very briefly. Just very briefly. Let me look at the vitals that my nurse got as you came in. Okay. And then I'll just listen to your heart and lungs real quick. Yep. And over here. And then over here. And then over here. Alright. And can you take a deep breath for me right here? And over here, deep breath. Perfect. Right here, deep breath. Exactly. And again, deep breath. Perfect. And then around back here. Take a deep breath. Okay, and over here, deep breath. And over here, deep breath. And over here, deep breath. Perfect. And then over here, go ahead and take a deep breath. And again, deep breath. And again, deep breath. And again, deep breath. Alright. Just gonna push on your belly a little bit here. Okay. Excellent. And then can you squeeze my fingers real quick? Just like that. Excellent. Okay. Perfect. Raise your arms above your head. Alright. And put them behind your head like that. And then back like that. Lift up your knee against my resistance here. Perfect. And again here. Perfect. And then kick out. Great. And kick out. Okay. So, just a couple more questions here. Let me actually pull up my little robot helper right here. So, tell me about your trouble sleeping. Do you have low energy during the day? Do you have problems with your cholesterol? That's fat in your blood. Okay. And then specifically a family history of heart disease. Okay. How about diabetes? Okay. If you've ever been pregnant, did you have a lot of problem with nausea and vomiting? And have you ever been pregnant? How many pregnancies? Okay. Do you have frequent congestion or any kind of breathing disorders? Okay. How about a family history of gynecological or other hormonal cancers? So that'd be like prostate, ovarian, breast cancer. Okay. Chronic pain or skin sensitivity? sound like you have trouble concentrating or thinking, and you need to improve like your cognition. Okay, that's perfect. So let's go over a couple of my recommendations for you, just things that you can look into incorporating kind of into your diet. So because of the hypertension in your family, it might be worthwhile for you to take regular passion fruit and corn silk tea. Passion fruit has long been kind of a folk remedy. It doesn't have side effects unless you are allergic to it. I haven't seen a ton of research on it, but it's certainly been widely recommended for high blood pressure, just kind of as a folk remedy, especially throughout Latin America. So that would be the first thing. The second thing is corn silk tea. Now this I do have. There was a study that found that it was antihypertensive because it makes basically an ACE inhibitor peptide, which is similar to the peptides that we, an ACE inhibitor is a kind of blood pressure medication, so that's a good thing. That's a good thing to kind of incorporate into your diet. So corn silk tea. And if you want to look up the study, it was by Dr. Jia Cheng Li and a couple other folks. It was in 2019. You can look that up on PubMed. They did that on rats. But that's pretty neat. Another thing that you should look into is things like green tea. Why? Because you had mentioned being kind of tired during the day and not wanting to take so much coffee. And maybe coffee makes you feel a little bit jittery. Green tea has tons of antioxidants in it and is phenomenal for improving your long-term energy during the day, which of course will help your sleep at night. Now, of course, you shouldn't take any tea, coffee, alcohol, anything like that within 4 to 6 hours of bedtime, because that'll make it a little more difficult to sleep. If you do take an evening tea, a white tea is going to be your best bet, and something like a lavender white will help you rest and sleep. There have been a couple attempts. People have talked about using lavender essential oils or something like that. There's actually not any good studies on lavender essential oil as far as like aromatherapy. The way lavender helps you sleep and decreases anxiety is by ingesting it. So take it as a tea. You can take it with a white tea, maybe 4 to 6 hours before bedtime to kind of start calming you down. That's what I would do. Okay. Yeah, lavender white. Now, you had mentioned some of that nausea and some of that vomiting, right, that you just have had, or that, you tended to have during pregnancy. Next pregnancy, I want you to consider peppermint ginger green tea. Why? I don't anymore, but I used to work a lot with obstetric patients, and it was just widely recommended for the kind of stomach issues of pregnancy. First, as soon as you get up in the morning, you take one saltine cracker, something else like that, to kind of get your stomach going. You just have it next to your bed before you even get up. You just take that and you lie there, okay? The other thing is to take regular vitamin B6. And vitamin B6 is good for you anyway because it helps to prevent depression. And it's also implicated in healthy skin, healthy nails, healthy hair. Yeah. So that's why sometimes I'll check your fingernails if you're depressed, to kind of get a read on, is that the problem or is something else the problem? Because there are a lot of things that can contribute to chemical depression. Yeah. So vitamin B6, and I'm going to write down my recommendations for you here because I know it's a lot of information kind of coming at you hard with vitamin B6. Peppermint ginger green tea, really good combination. Energy burn during pregnancy. The peppermint is very, very soothing for your stomach, and ginger is very, very soothing to prevent nausea. And in fact, there are anti-nausea compounds that are used like Dramamine. Like there is, because of course Dramamine is the drug that people take to not be seasick and ginger compounds that work similarly. So, something to consider. Now, you mentioned the history of diabetes and lipid problems, heart disease in your family, right? So for that, I would recommend taking a chai tea. Now, all of these recommendations I'm making are for you without sugar, okay? Because if you're putting all this sugar in your herbs, you're kind of counteracting some of what you're doing. So you want herbal concoctions that are going to be delicious, but not like sugary and so forth, not all sugary, because you don't want to be, harming yourself, your small blood vessels, in your eyes, the tip of the penis, which, obviously, since you've been pregnant before, that's not an issue for you, but something to consider, in the fingertips, all these different kinds of things, all the small blood vessels, especially in your toes, they can really be affected and clogged up by sugar. That is why erectile dysfunction, one of the big causes of erectile dysfunction besides obesity, smoking, diabetes is another big one, because you start hurting both the blood vessels and the nerves with too much sugar. So, it's, regardless of what your sex is, it's just better if you can use a more natural additive, something, for example, like stevia. Because stevia is a plant, just like technically sugar from the sugar cane is also a plant. It's been processed and distilled, and it's a little bit too much. It's a little bit too much for what your body is able to handle, because the main compound in it is sucrose. The main compound in stevia is a slightly different and more complex compound. And the problem with very simple sugars like glucose, sucrose, and fructose is your body just grabs those up and converts that into fat right away. It's not fat that makes you fat, contrary to, popular opinion, which I know we all grew up believing that, fat is the big enemy, because there were a bunch of sugar lobbying companies that lobbied the FDA around the time, a little bit before the time we were little, lobbying the FDA to support kind of recommendations against fat, but not make any recommendations against sugar, right? The idea, it was a financial goal, right? So the big Harvard study that found that sugar wasn't bad for you, but fat was funded by sugar companies. Okay, so that's not good science. And of course, we all remember growing up looking at the pyramid on the cereal boxes. I wonder why it was on the cereal boxes, saying that grains is the most important thing, as the foundation of your diet. That's all BS. Okay, what you actually need to be getting, the majority of your diet should actually be leafy greens, colorful greens, not things that are just yellow and white, but things that are purple and blue and the whole rainbow. So some good eggplant, kale, spinach, broccoli, carrots. That should be actually the bulk of your food. That should be half of your total food volume. So anyway, when you're looking at all that, the things like fats and things like that can be part of a really healthy diet for that. Obviously, everything in moderation. But the bad thing is really simple sugars. Okay, so simple pastas, simple breads, sucrose, glucose, those kind of things. You want really complex starches, complex sugars, and so stevia is a more complex sugar, so it doesn't increase your glycemic index. Because it's also an entirely different compound, triggering your taste. So, in Paraguay we call stevia ka'ane'e. Yeah, isn't that cool? So I would recommend, switching out sugar for that, and if you can get it in an herbal form, so much the better. Ka'ane'e has been used for, centuries to flavor day-to-day, and other South American, drinks, just as leaves, and so if you can get it as leaves, the more power to you. You can distill that in your tea with these other teas. So, and you should drink one of these every day, basically. So, the other thing, so anyway, I was saying chai tea. When I'm talking about very specific set of compounds. Okay, I'm talking about including cinnamon, I'm talking about including cardamom, I'm talking about including like the ginger. So these kind of these good things. And I'll pull it up here, kind of the exact like compounds that I'm looking. It's really the masala chai tea blend. Okay. So what we're looking at, we said cinnamon, cardamom, cloves, nutmeg, that kind of combination. That's what you want. That's what you want to get. Now, obviously, a chai tea, a real chai tea, unless you're getting one that has had the tea removed and it's actually just the other herbs, black tea is going to be very stimulating. It's going to be the strongest caffeine content. So just be careful with that. Again, don't take that more than 4 to 6 hours before bedtime. I would move that actually and make that your morning drink. If it was me, I'd do morning chai tea, kind of get things going. During the afternoon, kind of whatever, some greens, and then as you're getting towards the afternoon, evening, grab some lavender white, something like that. So that would be what I would more or less kind of recommend for you. And of course, green tea you can kind of grind up in your smoothies. You can put it, blueberry smoothies, everything else like that. Some people believe that it can prevent infectious disease. I haven't seen particularly good studies on that, but certainly some researchers have kind of compiled evidence that it seems to be that way. I haven't read a good randomized control trial that really proved that. I have read good trials for improving cognition for green tea, so for helping your brain to basically feel better. So I have seen that. Yeah, absolutely. So another one that I wanted to recommend you for energy specifically was jujube. Yes, so jujube tea. It's used in traditional Chinese medicine for fatigue prevention, cancer prevention, and so forth. I'm never going to make a claim of an herb curing cancer or something like that. I don't feel safe making that kind of claim. As a physician, I just don't think there's a lot of evidence for anything like that. You're certainly welcome to believe what you like. I would say look at PubMed before you, and dig into the studies before you make assumptions. Just because something can kill a cancer cell in a petri dish doesn't mean it can kill a cancer cell in you. I can also kill cancer cells in a petri dish by dropping them on the floor. I'm not going to drop you on the floor in order to kill your cancer, okay? Although I guess if I drop you from a significant enough height, both you and the cancer will be dead, so. But, you see what I mean. However, so there was an in vitro experiment that found that compounds from jujube did inhibit cancer cells. Again, this is in a test tube, not in a real human. So take that with a lot of, not just a grain of salt, just dump salt right up on there. And then, of course, what's kind of neat is that there was a study that found that trichomonads, which is the infectious thing in trichomoniasis, those were inhibited by black tea. Jujube didn't do the same thing, so also don't take people saying that, jujube can prevent or get rid of infections or something like that. However, taken in combination with 2 other compounds, it did improve sleep quality when taken over a month and reduced fatigue severity. So, I would take your jujube in the evening, because it's not caffeine, around the time or after you take your lavender. And it's a naturally sweet fruit, so yeah, it's kind of a perfect tea to kind of add to your repertoire. Another one, nani tea. Nani prevented bone loss in estrogen-deficient rats. Yep, so like rats that have been forced into a menopause, basically. And don't worry, I'll get these things written down for you. So that's kind of a good thing. Another thing is there was an exhaustion test in swimming water-weighted animal models, which I think is a horrible kind of experiment to do. And nani tea was better than juice or green tea for microangiogenesis, antioxidants, neurotransmitter, cortisol regulation, and mitochondrial biogenesis. So it helped promote energy and delayed fatigue. So, nani, that has long been used by, traditional Hawaiian medicine. Yep. And then I think the last thing that I would like to recommend to you is going to be rose. Now, there are a lot of challenges with herbal research in general. Rose has been used, forever, forever and ever, and does, for almost everything. So, you can, I just recommend that you can take petals and put it in your salad. You can, use rose water. You can do things in your tea. You can use it as oils. Purified compounds, again, same thing, put into stuff, did like kill HIV or kill other different, horrible things. Again, that was in a test tube, not in a person, but still something to think about, Antioxidant, anti-diabetic. If you boil rose, it can kind of help get your stool moving as well. Yep, so a lot of really, really good things there. So I would recommend you start putting rose into your diet regularly as well. Any questions? This is your handout. And then down below as well, I do have a place where you can get some of these things. Not all of them. Some of them you'll have to get on your own. But some of them you can get down below through me. I, personally test, my suppliers and make sure that they're ethical. That part of proceeds goes to helping the needy, and that, we have good ingredients and it tastes good. So some of the things I can get you down below, and then just in case you've kind of forgotten some of the things, I have a link to a little droid, a little tea robot, that can actually help you kind of personalize even further, and kind of select, because if you're only going to get one, what would be the best thing based on your health for you to get? Obviously, again, we're here in this secret place. This is not official medical advice for diagnosis or treatment of any illness. But it's good medical education, and I think some of the stuff below is going to be good for you. I mean, that's why I've curated it. That's why I've put it together. So definitely check that out. Now, you can fact check me on any of this. I have another session